Okay, good morning. My name's James Stanger. I am an embryologist with 50 years experience, and I'm doing a short take for Fertile IVF Daily's YouTube channel. This talk is on ovarian tissue cryopreservation in the context of extending one's reproductive life. There's more than 2,000 articles published every year based on IVF, and 5 to 10 times that on gametes of egg, sperm, and embryos plus fertility. It's far too much for everyone to take in, and it's difficult for clients to sort through current information to be able to ask questions of their doctor. And the intention of these short takes is to distill the information in selected articles which they consider may be relevant to your treatment and may provide a foundation for questions to ask your doctor. This is not medical advice, but a summary of published information in scientific journals. Okay. Today's topic is about ovarian tissue cryopreservation from an article called Forever Fertile, Ovarian Tissue Cryopreservation for an Extended Reproductive Lifespan. This is the access only. If you wish to read the whole journal, you can go to the Journal of Assisted Reproduction and Genetics and buy the article for €40. However, the summary of this topic is more than covered adequately in the abstract. So let's just read the abstract first, and I'll make a comment towards the end. The global decline in birth rates highlights the need for effective fertility preservation strategies. Even though oocyte cryopreservation is a well-established technique in cancer patients and is increasingly requested for elective fertility preservation, its success is limited by the age in which the oocytes were frozen, and restoration of ovarian activity is not provided. Ovarian tissue cryopreservation, on the other hand, is emerging as a promising alternative for both fertility preservation and reproductive lifespan extensions. Unlike oocyte cryopreservation, ovarian tissue cryopreservation restores the endocrine function of the ovary, potentially delaying menopause and reducing associated health risks. But more importantly, it may extend the number of ovulations to more than just the oocytes that were collected and frozen. Although concerns exist regarding the graft longevity and surgical invasiveness, recent advancements such as improved cryopreservation techniques, neovascularization strategies, and minimal invasive approaches enhance its feasibility. Additionally, ovarian tissue cryopreservation allows for spontaneous conception, reducing the need for assisted reproductive technologies, which are expensive. As demand for reproductive longevity increases, the medical community must address ethical and regulatory implications while refining clinical applications. Integrating ovarian tissue cryopreservation into elective fertility preservation, lots of words, can provide women with more reproductive choices, which is the aim, aligning with advances in longevity medicine. Future research should optimize the graft survival and assessing long-term health outcomes of delayed menopause to fully unlock the potential for ovarian tissue cryopreservation. Okay, so this topic is about an alternative to freezing your eggs. Currently, there is a huge number of cases where women are having an ovarian stimulation cycle. Eggs are collected and then frozen in the likelihood they may be needed if they wish to pursue pregnancy when they are perimenopausal. It works very well and it's very effective, but it's limited by the limited number of eggs that you collect, of which only about 1 in 8 or 1 in 10 will ever produce a baby. So there's a huge amount of work being done to collect the eggs, of which only a few are able to be effective. The eggs are very vulnerable to cryostorage perturbations, and one never knows which oocyte you have to thaw out. So there are some issues with it. Plus, if you have some eggs frozen and then you only have a cohort of eggs, it might be 8, 10, 12, 15, that's all. Ovarian tissue cryopreservation, on the other hand, is different. This is where a small piece of ovarian tissue is dissected out of the ovary, cut into very small pieces, and then frozen. And then when required, each piece of ovarian tissue can be thawed and then surgically inserted back into the ovary, of which the majority of those will re-establish blood flow and will become a functional tiny bit of ovarian tissue. The initial work has demonstrated that it's feasible, but as the experience increases, more and more are delivering healthy babies with no other interventions required. So in that case, you may have 3 to 10 small pieces of ovarian tissue each with hundreds and hundreds of oocytes, primordial oocytes. They can be removed individually and reinserted surgically, which does involve a medical intervention. But after that, up to 3 to 6 months it may take for that surgical implant to become re-established, start ovulating. And I understand most implants have several number of ovulations over a couple of years. It also means that unlike oocyte cryopreservation, you can fall pregnant naturally, and you may fall pregnant more than once. And I think that this is a topic that clinics need to raise with you if you are having fertility preservation, and it's something that you need to raise with your doctor. I wish you all the best. Thank you.